Get this, every year more than 1.5 million people are killed on the road around the world. The World Health Organization says without action, road traffic crashes are predicted to result in the death of around 1 million people per year by the year 2020. To 20 million to 50 million more people will suffer from fatal injuries due to traffic accidents, and many become disabled as a result. Let's look at the numbers. WHO says 38% of all African road traffic deaths occur among pedestrians. Young adults aged between 15 and 44 years account for 59% of global road traffic deaths. Africa has the highest road traffic fatality rate in the world at 21 deaths per 100,000 people. Europe has the lowest with only 10% deaths per 100,000 people. Now joining us via phone from Geneva is Dr. Melecki, Technical Officer with the World Health Organization's Department of Violence and Injury Prevention and Disability. Dr. Khayesi, welcome to Africa 54.
Thank you very much.
Now, when we look at the numbers, 38% of all deaths on the road in Africa occur among pedestrians. Why are pedestrians in such high risk of getting killed?
Yeah, thank you. We have several factors, but one of the main factors is that we've not provided for the facilities that can cater for the pedestrians to actually be able to cross the road. And this has to do with infrastructure. For example, sidewalks or footpaths are really poorly developed in Africa. Then related to this, we have the problem of speed, which is a major risk factor. You know, the vehicles, when they're driving, the high speed and lack of enforcement of the speed. And then we have issues related to drinking and driving. So if we can deal with engineering issues, with speed issues, with enforcement issues, and really improving the infrastructure for pedestrians, then we can improve the safety of pedestrians in Africa.
So until the infrastructures are improved, what can the pedestrians do? What are they doing wrong so far, even though most of the reasons, as you mentioned, do not really come from them?
Well, that's good. The observation is quite correct that it's very easy for us to place the blame just on pedestrians. We know we are dealing with a complex system, dealing with the infrastructure, dealing with user, this is drivers, pedestrians, and cyclists, and dealing with enforcement. Of course, one could easily say let pedestrians behave well, but that is just one-sided view. It's important that we address this issue in a holistic manner with behavior issues affecting not just pedestrians, but other other road users like motorists. So I'll really urge that we focus holistically on all these issues.
So quickly, if you were to talk about policies there, what would you say is perhaps one of the most important policy that needs to be either put together or implemented, reinforced?
Yeah, let's really put in place and enforce speed as a very critical issue. Let's also provide infrastructure, separate pedestrians, for example, sidewalks, make sure that, the infrastructure, for example, there's a lot of road construction going on in Africa. So it's important that we provide for facilities, sidewalks, crossing points for pedestrians, and then really enforce existing traffic laws so that we attain this, address this as very critical factors. Yeah.
Okay, Dr. Khayesi, we appreciate your insight. Thank you so much. And that was Dr. Melecki Khayesi. He is a technical officer with the World Health Organization, Department of Violence and Injury Prevention and Disability. And that's our Africa Health Network report for today. For more health news and development, be sure to visit our website, africahealthnetwork.com.